New research finds that states with strict abortion restrictions are seeing higher rates of maternal deaths. The Commonwealth Fund analyzed data from 2021 through 2022 following the overturning of Roe v. Wade and the subsequent enactment of state abortion laws. It found that the most maternal deaths occurred in the Mississippi Delta, where a large percentage of counties do not have access to reproductive care. Dr. Carolyn Sufrin joins us from Washington now. She's an associate professor of gynecology and obstetrics, at Johns Hopkins School of Medicine. Thank you so much for joining us. How are abortion restrictions linked to this increase in maternal deaths?
Well, the states that have banned abortion in all or nearly all circumstances are also the same states that have the fewest maternity care providers. So if you think about that, if you're a pregnant person and you live in what we call a maternity care desert, where there's no obstetric provider or maternity care hospital, if you live in a maternity care desert in Mississippi and you need prenatal care or other resources, or if you have a pregnancy complication like high blood pressure, or if you go into labor and are having your baby, you have nowhere to go that is in your community. And so what we find in these states that have maternity care deserts is that they are also the states banning abortion. The correlation here is that these are states that do not care about the well-being of pregnant patients, parenting people, and their families. But on top of that, abortion bans themselves can prevent people from obtaining life-saving necessary medical care. And we've seen in some states, including Texas, which banned abortion even in many circumstances, even before the Dobbs decision, we have seen an increase in maternal morbidity and mortality from pregnancy complications that could otherwise have been safely managed with abortion. And what's also important to highlight about this correlation between abortion bans existing in the same states as maternity care deserts is that it does not affect all people equally. We see profound inequities in impacting Black women and Indigenous women having higher rates of death in pregnancy and also having more difficulties accessing the abortion care that they need.
If the goal is to have more mothers carry babies to term by getting rid of access to abortion services, wouldn't it stand to reason that you would have more mothers in the world who would require maternal care, and therefore this was a foreseeable challenge to existing resources?
That's right, John. This was absolutely foreseeable and was already existing even before the Dobbs decision paved the way for even more abortion restrictions. And it shows a lack of internal consistency, right? If you really are concerned about the well-being of pregnant individuals and babies they may give birth to, then you should be investing in them having healthy pregnancies. But you also need to be investing in their families and their communities once they have given birth. And these are also communities where we see a lack of appropriate resources, lacking affordable housing, access to a wide range of healthcare, adequate nutrition, many other factors that would otherwise support healthy, thriving families.
So, Doctor, what is let me ask you for two kinds of solutions. What is the larger healthcare system solution that might be possible? And then what should individual patients, pregnant mothers, do if they find themselves in one of these deserts?
Well, I'll start with the individual patient one. If they find themselves in one of these deserts, the answer seems obvious. Get yourself to a place where there is healthcare. However, that is not equally feasible for everybody. And the ability for people to travel either for a delivery or for a needed abortion is very limited for many people, especially those that are already living in these communities that have been disinvested. In terms of the bigger picture, we need to reverse the abortion bans and recognize that abortion is healthcare and is a part of comprehensive pregnancy care. We need to ensure that states fully expand Medicaid to cover not only during pregnancy, but also up to 12 months postpartum and beyond. People live after they are pregnant. They are still people in this world who need healthcare coverage. And we need to invest in other resources in their communities to ensure that they can have healthy, thriving lives, adequate nutrition, education, housing, all of the things that can support healthy families.
Dr. Carolyn Sufrin, thank you so much.
Thank you.